Sumperk Hospital is the second largest provider of healthcare and social services in the Olomouc region. We are a fairly broad, multidisciplinary hospital. To give you an idea, more than 20,000 patients are hospitalized here every year. We treat more than 300,000 patients in outpatient care. In terms of operations, more than 8,000 surgeries are performed in our operating theaters. Before we implemented Fleet Care, we encountered standard problems similar to other healthcare institutions. These included the variety of suppliers, the inconsistency of individual surgical instrument sets due to the consideration of surgeons' habits, and, above all, the unpredictability of costs.
The biggest problem was the number of surgical instruments, which were constantly being added to the sets according to the needs of the surgeons. No one has addressed whether the instruments are still in use or not.
The surgical instruments came from various manufacturers, and the quality varied. This led to problems in the operating room, such as blunt scalpels and scissors, frustrated surgeons and nervous nurses, resulting in prolonged surgeries. This situation was unsustainable.
Therefore, we carried out an inventory analysis with B. Brown to analyze the surgical instruments at our hospital. Our fears were confirmed. We had more than 5,000 surgical instruments that were not always in good condition. Some were damaged, some were unusable.
It was excellent that we had the opportunity to visit Tuttlingen in order to do a set consulting. We discussed the sets of several surgical departments with nurses, surgeons, and department heads in our hospital: gynecology, general surgery, urology, and orthopedics. We went through the current set structure and content of each surgical set and discussed their requirements. That was very important.
The biggest benefit for us has been the reduction of surgical instruments. We reduced from 5,000 to 3,500 instruments. This eliminates unnecessary wear and tear on surgical instruments. It also reduces weight and staff effort. Another advantage is the automation and digitalization of the set lists for assembling the sets. New staff can be quickly trained because they can see pictures of the surgical instruments and the content of the entire set in the digital tool. A huge benefit is that Fleet Care ensures functioning surgical instruments as they are repaired and replaced by a SCULAP technical service. Last but not least, we also have a backup stock in place. If the surgical instruments are damaged, we can replace them on the same day and get the complete set back to the operating room.
Fleet Care means quality instruments for us. Everything works as it should. Surgeons are satisfied. We have no complaints, and calm nurses. Surgeries have become shorter. Surgeries are not delayed. Changes have been significant.
From a management perspective, the positive aspects of Fleet Care are clear predictability of costs, reduction of operating costs and standardization, and optimization of surgical sets. I am delighted that in recent years, in collaboration with our colleagues in B. Brown, we have become an international training and educational center for Fleet Care and Total Pathway. I consider the collaboration with B. Brown in recent years to be very fair, trustworthy, reliable, and an example of how collaboration should work, where health, safety, and quality are not just words.